Hi, my name is Mayank, Bhayana, and I'm a third-year medical student. Today I'm going to talk briefly just about ADHD, Attention Deficit Hyperactive Disorder. ADHD, previously called ADD, is defined as a persistent pattern of inattention and or hyperactivity that is more frequent or severe than expected for a given level of development. However, there are different ways of looking at it. One such way can be patients have difficulty regulating their attention, or patients have difficulty inhibiting their attention to non-relevant stimuli, or patients have difficulty just focusing on a specific stimuli and they focus too intensely on stimuli that's not relevant. In one sense, rather than too little attention, many people with ADHD may pay too much attention to too many things, leading them to have little focus. Contrary to some media accounts, ADHD is not new. It's actually been around since the early 1900s. But the emphasis has been on the hyperactivity component. There are 3 areas now of ADHD that the DSM-4 describes, and these areas include inattentive type, the hyperactive impulsive type, and the combined type. The inattentive type includes failure to pay attention to details, failure to focus attention when performing tasks, failure to follow through with instructions, impaired ability to organize tasks, misplacing items, becoming easily distracted by external stimuli, and forgetfulness during the performance of daily activities. The hyperactive impulsive type, would include increased fidgeting of the hands and feet, inability to stay seated in a classroom setting, being too noisy during playtime activities, and persistent pattern of increased motor activity. The impulsive type of this component would be blurting out answers, difficulty waiting in line or for one's turn, interrupting, and talking excessively without an appropriate response to a given social situation. And the combined type is just a combination of the inattentive and the hyperactive impulsive type. Now I'm going to talk about the clinical approach to ADHD. And the first thing I want to talk about is the diagnostic criteria. The patient exhibits 6 or more symptoms of inattention or hyperactive impulsivity. Another component is that there's evidence that these symptoms were present before the age of 7 years. The impairment is present in more than one setting, such as school, work, or home. The disturbance causes clinically significant distress or impairment in social, academic, or occupational function. Now I'm just going to talk briefly about the past medical history of the patient. It's important to remember that sometimes in homes that don't have a lot of structure, the parents can initially not realize that the patient's attention span is poor or that the child is unusually hyperactive or impulsive. You want to screen for medications or supplements that may have negative interactions with ADHD medication. You also want to screen for medical concerns that may have negative interaction with ADHD medications. Approximately 30 to 50% of patients with ADHD have other significant psychiatric problems, such as generalized anxiety disorder, obsessive compulsive disorder, bipolar disorder, conduct disorder, and oppositional defiant disorder. You also want to inquire about a family history of ADHD. In social history of the patient, you want to look for things like home and family interactions that are consistent with ADHD, problems with the legal system, school performance, family dysfunction, social skills, and finally substance abuse by the patient. Some of the differential diagnoses of ADHD include anxiety disorders, post-traumatic stress disorder, bipolar disorder, sleep disorders, depression, dysthymic disorder, and finally hyperthyroidism. ADHD is based on clinical evaluation, so there's no laboratory-based medical test that can confirm the diagnoses. But you can use laboratory studies to help gear towards a diagnosis of ADHD. So you want to do a serum CBC count with differential, electrolyte levels, a liver function test, and finally a thyroid function test. Some psychological testing that you can do with the patients include the Connors Parent Teaching Rating Scale, which is a questionnaire that's given to both parents and the teachers to fill out. Another one is Barkley Home Situations Questionnaire. Another one is the Wender Utah Rating Scale, which is mostly used for adults with ADHD. And finally, another one is the continuous performance test, which is a computer-based task that often is used to test attention and may be used in conjunction with clinical information to make a diagnosis. And finally, the last component, we want to talk about treatment. The first line therapy and probably the most effective treatment of ADHD is stimulants, such as methylphenidate and dextroamphetamine. All stimulants have similar efficacy but differ by dosing, duration of action, and adverse effect profiles based on individual patients. Some symptoms that you want to target with these stimulants include impulsivity, distractibility, poor task adherence, hyperactivity, and lack of attention. And another treatment option that may be helpful is behavioral psychotherapy. This isn't the first line of therapy like stimulants, but it also helps when you use a combination of behavioral therapy with stimulants. Okay, thank you for paying attention for this ADHD presentation.